Namaskar. So, now dear learners, we are moving to our second part of the topic, that is solid waste and associated health issues. Myself Professor Subhas Anand, teaching geography at Delhi School of Economics, University of Delhi. So, the topic which we are having in second video is basically solid waste and its impact on human health with a special reference to rag pickers. The major objective of the video is to identify and quantify the specific health risks associated with solid waste by establishing the links between solid waste exposure and specific health risk faced by waste management workers, particularly rag pickers. The learning outcomes of this video, after going through this video, you will be in the position to understand the conceptual framework of solid waste management, the relationship between solid waste and human health with direct impacts through the exposure. Analyze the critically impact of solid waste on human health with infectious disease spread due to the mismanaged of solid waste, and you will also in the position to gain insight about the global occupational health hazards in exposure to toxic substances and multiple injuries disorder, and finally you will understand about the contribution of rag pickers in solid waste management process. The video will cover few contents, that is the overview of solid waste management, types and classification, municipal solid waste and human health, impact of solid waste on human health, global occupational health hazards, rag pickers, the role of rag pickers in solid waste management and also for the public health, and the case study, few conclusions and recommendations. So, dear learner, the solid waste management is a integral part of sustainable urban environmental management. It is one of the important crucial issues of public health in 21st century. Nowadays, we are focusing for maintaining good health of the people, but this health is being influenced by many different aspects like solid waste. Any materials which has thrown away because of no value in the eyes of its generator is called waste, and solid waste is applied to unwanted and discarded materials coming out from different sources like residential areas, commercial areas, institutional areas and others. And so, the main purpose of sustainable solid waste management is to minimize the negative impacts on human health and also on natural resources. The public health impacts are determined by the overall waste management strategies at different scales: local level, regional level, national level and global level. So, basically the health impact are determined global to local, and there is a dire need of integrated solid waste management which would be cost effective, scientifically better, environmentally and health friendly and socially acceptable to the people. The generation of the solid waste and the collection, processing, transportation and disposal. All these steps are found in entire stream which is called solid waste management. So, the solid waste management start from generation to the disposal of the waste materials, and this solid waste management play very significant role for achieving the higher level of environmental sustainability and for having good health. Out of the total solid waste disposal methods, the landfilling method is major, which is basically prevailing in low developed countries and developing countries, but having the adverse impact on public health, and particularly the people who are engaged in the solid waste management process, especially a category known as a rag pickers. The rag picker communities also having the negative impact, significant adverse impact of solid waste on their health. So, there is engagement on many stakeholders in the solid waste management process, that include community, non-government organizations, community based organizations, resident welfare associations, municipalities and rag pickers. There is found different types of solid waste, and the waste type can be categorized into several groups based on their origin, their composition, their characteristics and their content. Different kinds of waste categories are there, like for example, municipal solid waste, industrial waste, commercial waste, agriculture waste, construction and demolition waste, hazardous waste, e-waste, biomedical waste and nuclear waste. And as far as the keywords are concerned to the solid waste, that include basically municipal solid waste, landfill, health hazards, rag pickers and occupational health and safety measures. These are few keywords which revolve around the entire solid waste management process and public health. This municipal solid waste pose a very serious threat to the public health and environment if it is not safely managed. And for the general public, the main risks to the health are indirect and arise from the breeding of many different diseases, as workers are in direct contact with the waste and the associated hazards. Without any protective safety equipment, they are so vulnerable to various health risks in common and particularly in the developing countries and low developed countries. And the impact of the solid waste on the health differ and depends on many factors like nature of the waste, composition of the waste, habits of the exposed population, duration of the exposure, prevention and management methods and practices. There is found some common occupational health and injury issues related to solid waste, like back and joint injuries from lifting heavy waste filled containers, respiratory illness from particulates, bioaerosols and volatile organics working in the smoking and dusty conditions at open dumps, infections from direct contact with contaminated materials, different animals, dogs, cows, pigs and rodent bites, puncture wounds leading to the tetanus, hepatitis and HIV infections, methane and carbon dioxide air emissions from landfill facilities aiding to vector-borne disease, volatile organic compounds in air emissions and inconclusive evidences on altered cancer incidence, birth defects and infant mortality and psychological stress. These are some common occupational health and injury issues which happened because of the improper management of the municipal solid waste. In poorer countries, there is found the higher risk for the waste workers, like there is a collection of the waste by intensive system, workers have less protection, most waste is not safely contained in readily liftable load sites, recycling is conducted from mixed waste rather than from segregated material at source. Many waste pickers are children and women, and disposal upon dumping. As far as the global occupational health hazards are concerned, the rag pickers are posed to direct health risk. Who needs to be protected as far as the possible from the direct contact with various toxics and hazardous waste. It is reported that per year about 270 million waste collectors worldwide suffer from occupational injuries, accidents, disease, and about 4 lakh to 1 million people die each year because of which are related improper, unscientific management municipal solid waste, and major diseases are diarrhea, malaria, heart disease, cancer, and many more. Now, question is that when there are different stakeholders in the process of solid waste management, the major stakeholder are rag pickers who belongs to the informal sector. The category of informal group rag pickers, they are informally engaged in the recovery and collection of the recyclable and reusable waste materials from different sites like dustbins, roads, streets, park, open space, processing sites, landfill sites, dumping grounds. And rag pickers are highly vulnerable to their workspace because lack of the awareness and lack of the support from the municipality and the government. And large number of rag pickers are found nearby in landfill site and dumping ground and slum areas. And most of the rag pickers are staying in JJ clusters, slums, jhuggi jhopdi. And on the basis of the workplace, rag pickers can be categorized into 4 groups like rag pickers at residence, rag pickers at commercial sites, rag pickers at dustbins, and rag pickers who are found at dalao or landfill site. Mainly in rag picking community, the children and women are engaged, and they are major victim of filthy environment conditions in their surroundings. The slides is basically giving the pictures how the rag pickers are engaged in collecting the recyclable and reusable materials from different sites. The rag pickers are considered a good instrumental in segregating and separating the waste and taking away the recyclable waste material for selling to the junk dealer, scrap dealer, only for getting the meager amount of the money, only for their livelihood. And generally they are working in very highly unhygienic environment and suffer personal health hazards. This rag pickers, which is considered as a vulnerable group, are socio-economically and health-wise very vulnerable to many occupational health hazards, and they work among the crows, dogs, pigs, cows, and many other birds. So, basically rag picker engaged on different dumping ground and landfill site only for their livelihood, and they are considered socially and economically backward. As far as the role and the contribution of rag pickers in public health and solid waste management is concerned, it is very, very significant. They are working only for their livelihood, but they are giving the positive contribution in environmental management, resource recovery, resource conservation and economy at the cost of their health. Pick up the recyclable and reusable waste material which have been discarded by the people, and sometime they pick infected and hazardous waste material and came into the contact physically, direct contact with the infected material and got suffering and injured. So, that is why in order to get their livelihood, they are providing thankless job to this community. They move from one dustbin to another dustbin, one landfill site to another landfill site in collecting and segregating the recyclable waste material without wearing the protective safety equipments with bare hands and feet, which make them very vulnerable for many diseases. Sometimes they suffer very serious physical health hazards at workplace, which threaten their physical safety by increasing the risk of physical injury. So, rag pickers are basically playing the very significant role in solid waste management, protecting the public health system even though their service go unnoticed and thankless. Or I can say that they are unsung environmentalists, they are true environmentalists because they are providing their service for our safe environment. They are prone to various occupational health hazards, from physical and mental health hazards, like they are having some disease, for example, respiratory disease, gastro disease, vector-borne disease, skin and eye infection, neurological disorder, non-communicable disease. This slide is basically giving you an idea about the disease which they are suffering during the waste picking. They work in the dangerous, highly demanding areas, like for example, they work in an area which are having the problem of the occupational health hazard. They feel different kinds of the pain in their body parts, like neck and back pain, headache, leg injury. Sometimes they got injury in different parts of the body. This picture is giving the situations of the rag pickers in different sites. I personally taken this photograph from the Meerut cities. Now you can put your glance here, you can see how they are working with different situations. This picture is giving an idea about the skin infections. They are suffering from itching, rashes, blister, body infection, teeth problem, eye irritation, redness, watery eyes, eye infections. And personally, I taken the photograph from different sites. This picture is from Ghaziabad. This child, which I taken a picture many years before from the Delhi. I conducted a survey in many cities of the National Capital Region, and when I went to one of the site, he personally narrated his entire story for his disease and his health. And I also, on the basis of the primary survey, I found that mainly 34% were reported the injuries in different part of the body, followed by the jaundice problem, chest problem, asthma, cough and the cholera. So, I can say that the rag picker are exposed to the considerable health risk from exposure toxins and the infectious materials. Slides is giving the idea about the respiratory and vector disease. The rag pickers exposed to the dust particle burn the waste near their houses and causing the respiratory problem, mainly cough and the asthma. And the waste and the contaminated water near their houses serve as a breeding ground for vector-borne disease. That is why sometimes they are having the problem of dengue, jaundice, chikungunya, and the common issues which are found among this rag picking community are diarrhea, constipations, unhygienic situations, and low level of immunities, because they work in highly filthy environment and unhygienic conditions and polluted areas. This figure is giving the idea about the Delhi. As per Delhi is concerned, currently the Delhi is producing the 10,900 metric tons of the waste. But it is good that currently in Delhi we are having 100% collection rate. But when this waste reach to the dumping ground and landfill sites, the rag pickers go there and try to find out there the usable, recyclable things and sellable thing for them, only to get the livelihood in order to earn some amount of money. But during this process of rank picking the material, they export certain disease and become so vulnerable. Currently, there are 4 landfill sites which I also mentioned out in last video, that Balaswa, Gazipur, Okhla and the Bhavana. In all 4 sites, we can see the number of rag pickers who are engaged to get the waste material for their earnings. This picture is giving the situations of the risk and the vulnerability. The photograph is showing the situation of the Meerut city. There are numerous vulnerable hotspots I personally found where the waste overflow, the bins, rag pickers pick up the some waste items, along with there is found dogs, pigs, crows, birds. So together they work, and during this process they get infected. So ultimately they work in highly unhygienic conditions, and there is found unscientific practice of waste management, weakening the urban sustainabilities and having the adverse implications on human health and environment. This picture you giving the situation, how the Balaswa, Gazipur landfill site having the problem, mainly in summer, particularly in the month of the May and June, we get the report of the fire because of the increased temperatures. And when there is a fire, because there is an emission of the methane gas, toxic gases emissions is there. And when there toxic gases, people feels very uncomfortable and many problem, particularly the people who are living in surrounding areas. Same one incident also happened in Gazipur landfill site, when the Gazipur landfill site burst into the flames on April 21, 2024, causing the dangerous heat and methane emissions. So ultimately we can say that the landfill site now converting and creating the different kinds of disaster for the people who are living in surrounding areas. And on this landfill site, the rag pickers works without any safety equipment and the measures. So in order to manage the situation of solid waste and having the proper sustainable health, good health, Government of India frame many rules and regulations. Currently we are having Solid Waste Management Rule 2016 framed by our central ministry, the Ministry of Environment, Forest and Climate Change. There are also different urban local bodies at central and also the state level. Many different bodies are working: Central Pollution Control Board, state pollution control boards in different states, different NGOs like CSC, Center for Science and Environment, Srishti, Vatavaran Chintan, Being Green, Clean Air Asia, Toxis Link, Help Delhi Breath, Goonj, Sahas Zero Waste, Delhi Greens, and also different community based organizations, RW associations are also working for the sustainable solid waste management. So, now finally we can conclude this video that solid waste management is a critical and crucial aspect of urban sustainability, which is posing significant occupational and environmental health risks. The management process from collection to disposal exposes the workers to various health issues such as respiratory disease, gastro problems, skin infections, musculoskeletal disorders, and many other psychological problems. And the health impact of mismanagement of solid waste is profound, affect the human health, especially in the vulnerable communities, that is rag pickers, and within the rag picking communities, particularly children and the women who are living nearby dumping ground and different landfill sites. So, that is why the effective solid waste management requires a comprehensive and integrated approach that includes proper segregation, safe disposal methods, and protective measure for the waste workers and also rag pickers. So, the integrated solid waste management should be driven by clear objectives and is based on the hierarchy of the waste management that should be focused on 4R strategies: reduction of the waste, reusing of the waste, recycling of the waste, and resource recovery. So, there are few recommendations for the integrated solid waste management for the sustainable future earth. There must be segregation of the waste at source. Different dustbins should be there for the organic and inorganic waste. Material recycling and recovery should be increased. Municipalities increasing their level of service to the public regarding the segregation of the waste. Promoting the use of less hazardous alternatives to the hazardous chemicals during the production of the goods. Proper health checkup should be there of the waste pickers. They should be given proper license and permissions, and they should be given each and every facilities which they are needed. And there is a highly urgent need for the sustainable urban environment for mitigating the health hazards and sustainable solid waste management for the future earth, for taking into account the confidence of the all major stakeholders, which includes the policy maker, industry, scientists, NGOs, community based organizations, and different other communities. So, dear learners, basically this was a video on solid waste and health impacts. For this topic, you can also refer different books, different write-ups and manuscripts and websites which are available online. Here there is a list of the books which are directly talked about the solid waste and its impacts on public health, and these are few websites which are related on this topic. Thank you.